So let's talk about our family of procedures we call Regenexx. So Regenexx, I'm going to get into who Regenexx is, but we can see we have different types of procedures. We have SD, which stands for the stem cells we were talking about earlier. AD, which we really don't do anymore, which is the fat-derived stem cells. Regenexx C, which is in the Cayman Islands, the culture-expanded stem cells. Our platelet procedures, which are called SCP, as I mentioned earlier, super concentrated platelets. And sometimes we use the terminology Regenexx RC for rotator cuff, Regenexx DDD for spinal, degenerative spine conditions, using either platelets or stem cells, or if we're treating tears of the ACL, that would be what we call Regenexx ACL. And Regenexx PL or PLM stands for platelet lysate. This is where we take the platelets, we rupture them open, remove the growth factors, and then use that typically around nerves, often in the back, for example. This is a network. Regenexx is a network of physicians throughout the United States and in part other countries. This is a partial list. This is getting updated frequently. There are many Regenexx doctors across the country. We're located down in Florida, and we're currently the only ones in the south eastern part of the United States. Okay, at the time that I made this slide, there were more than 32,000 Regenexx procedures that had been performed. And this number is growing constantly, quickly. This is since 2005. It should be emphasized that Regenexx has published more than 51% of the world's literature as it pertains to stem cell procedures for by injection for orthopedic conditions. So Regenexx is by far the leaders in the world in regard to these types of strategies. There really is no close second. This slide shows some Regenexx ebooks that have been published, as well as various animations that have been done that summarize a lot of the research into these animations. I encourage you to go onto the website and watch some of these. There have been some professional videos and some stories done, reports and so forth, and there's a lot of information in these videos, and it's a valuable source of information for you. Why would someone choose Regenexx? Why did I choose Regenexx? I was doing regenerative procedures prior to joining Regenexx in 2012 for a number of years, and was getting pretty reasonably good results. But as an individual doctor, there were some limitations in my ability to continue to grow in this field, to get better, to learn more. I looked around the country to see who were the leaders in this field, and Regenexx by far was the one who they were doing the basic science research, the clinical research, the protocol development, affiliating creating a network of doctors that can move this field in the right direction. Every new field requires organization and strengthening of that organization over time, and this is why I felt that Regenexx was right for me, and I'll explain to you why I think Regenexx may be the right choice for you. So we represent a new medical specialty, as referred to interventional orthopedics or interventional regenerative orthopedics. So, as biologics, where we talk about the platelets and the stem cells, and the delivery devices and the methods improve, most of the orthopedic surgeries will be replaced by these precise needle-based procedures. So our goal is to use less invasive procedures to avoid the need for the more invasive surgeries. 3 levels of accuracy in stem cell injections. So unfortunately, a lot of people, in the last few years, there have been a lot of people deciding to jump on board and say that they do stem cell injections. And unfortunately, not everyone is doing a good job with them. We think precision is crucial. Most people are doing this blindly without any imaging at all. Other people are doing the imaging but not doing a good job with that imaging to get the needle precisely to where it needs to go. And very few are doing these very precise, targeted injections into the tissue, visualized safely. And we all know that in the Regenexx Network, we're all trained to do it that way. So again, Regenexx are the world leaders in performing these procedures. The longest and the best safety record. There's a great deal of expertise. This number is likely inaccurate at this point. It's grown. But there are many network sites and licensed physicians who are trained who are handpicked for the subspecialty expertise and their skills with the use of ultrasound and fluoroscopy or X-ray injection skills. The training is ongoing, continually improving. It's at an extremely high level. We continue to refine our protocols. We continue to share our best practices. Their biomedical research team that's helping to develop better. Regenexx is publishing frequently on the data we have from our registry and from other protocols and case studies. There are randomized control trials, which are considered to be the highest level of evidence, that are ongoing. There have been publications on safety, on outcomes, on the basic science of how stem cells grow. All the patients are tracked. All the patients who receive a procedure are asked to agree to be tracked by a professional team of researchers who can determine through questionnaires and contact how safe the procedure is and how effective the procedure is. This is crucial. Nobody can really sit in front of you and tell you how effective this procedure is if they haven't collected data. It's all guesswork. Fortunately, we have a fair amount of data to be able to accurately give somebody true expectations of these procedures. We don't want to sugarcoat it for anybody. Not everything works well for every person. The products that we're producing are much higher level, much higher quality. Stem cell quality, the stem cell counts, the growth potential. They're more active. There are more live cells in the way we're doing our procedures. The platelets are purer. They're better at stimulating the growth of stem cells. This is all through high-level research. Regenexx SD and beyond. SD+, there's SD++. These are all methods of improving the way we get stem cells and process the stem cells. We're able to get 15 to 20 times the number of stem cells when we compare it to what are called simple bedside centrifuges that are used by most doctors. We even have a more recent edition of SD++, which gives us an additional 13% more stem cells on top of our SD+ product. And we use this in conjunction with the platelet lysate, or the growth factors from the platelets. These are highly concentrated growth factors that we know stimulate stem cell growth quite well.